Today, I'm answering your questions about pelvic exams that you posted on a recent video I shared when I demoed a pelvic exam on a simulation model. So let's get going. Hey everyone, welcome back. I'm Dr. Jennifer Lincoln, board-certified OBGYN, educator, author, and this channel is the health class you wish you had in high school. If you are not already subscribed, go ahead and do it and hit the bell so you never miss an upload. Today, I'm following up on a video that I did recently about pelvic exams, and I showed step-by-step what a pelvic exam is like on a simulator model that I had. And I talked about why we do pelvic exams, the parts of it, just to really help empower you so that when you come to see us, you actually have an idea of what the heck is going on down there? And I got some really good questions and comments that I wanted to follow up on because I think that they're really important. And if they're asking me these questions, I know other people have these questions too. So I'm just going to jump right in. And the first one was actually not a question, but a comment that said, I'm too self-conscious for this. I keep delaying it. And I got a few more of these comments as well on other platforms. And that breaks my heart because I want you to know that I know these exams can feel vulnerable or uncomfortable, but it's literally part of your health and can be life-saving. The people in this country who still get cervical cancer far more often than not are people who've never had a pap smear, who've never been seen. Because so much of what we do, we can treat or we can help prevent and we can change the course of if we catch it early. And I'm not just talking about cervical cancer, I'm talking about other issues too. So I hope that you realize that the shame that you're feeling is not your fault. It is society's fault when we don't teach people what their bodies are, when we're afraid to say words in public. And I'm hoping that my content helps you feel more comfortable and know that this is our job. We chose this. I promise you there's nothing that you can say in the office that will make us feel like you should be embarrassed or shocked or anything like that. So I hope that continuing to see this sort of stuff out there normalizes it and you feel empowered to make your appointment. Okay, next one. I had a couple people ask me this. Can you still feel the uterus and ovaries on a person with obesity? And someone else was asking, how do you know if you can't feel the uterus, the ovaries, the muscles? How does it work? And that is a very valid question. And I'm going to be honest. A lot of the time we can't feel it. And this is why obesity is not just an issue with the things that we typically think of when we think of having obesity, like diabetes or high blood pressure. It also makes it more difficult for us to be able to detect other things completely unrelated to that. So it's true when I do a pelvic exam, if you have more subcutaneous fat in that area, when I'm doing that, where I showed that bimanual where I'm got one hand on the abdomen, I can't really feel your uterus. I can feel with my vaginal hand, I can feel your cervix. Sometimes I can feel part of the uterus depending on how it's positioned, but the chance that I'm going to be able to feel those structures and in a thorough way is much less likely. Now, that doesn't mean that you shouldn't come in or we still shouldn't do these exams. Absolutely, we should. But if we feel like we're worried we're missing something, there's other things we can do. For example, we can get an ultrasound because then I can see your uterus and see your ovaries. So I know that there's a lot of fat shaming that happens in the medical field still to this day. Absolutely. And it's not okay. And we need to work on it. And I want you to know that you still deserve care no matter what the numbers are on the scale. And if somebody has shamed you or has said, oh, why are you, I can't even feel why do we even do this? That's not okay. There's ways to still care for you in a respectful, thorough way. And sometimes it just involves us doing some other different things, but we don't have to shame you to do that. Thank you for asking those questions. This was kind of a comment and a story that I've gotten a lot in different ways. And this was somebody who was sharing that they recently had their first exam and she had mentioned that she'd had pain before and the OBGYN didn't delve into it and just said, yeah, we'll see. Didn't stop when the exam was painful. Didn't note anywhere in the chart that it was painful and just felt like she didn't feel like she got the care she needed or deserved and wanted to know, who does she talk to? And first of all, I'm sorry. You should not have been treated like this. I know when I do these exams, I tell people if something feels uncomfortable or it hurts, tell me and I'll stop. No questions asked. Does it maybe take a little more time? Maybe, but it actually probably saves me time on the back end because we're able to figure out what works rather than not getting an adequate exam because somebody's so painful and we have to repeat it. Also, it's just about respect. So I'm so sorry that happened. And I think that this is a huge red flag and you need to find a different doctor ASAP because if you were treated this way already and you went out of your way to communicate ahead of time, then this is somebody who's not listening. And in terms of wanting to file a complaint or report it, I think that's absolutely fine and within your scope. Because you're right, if this person treated you like this, how else are they treating other people? So you can go up the chain. You can talk to the practice manager or the patient advocate. If it's a private practice and there's nobody above, it's just them, it's a little trickier because like, who do you talk to? And you can file a complaint to their state licensing board, or to if they're an OBGYN, the American Board of OBGYN. So there are ways to do that. And it is absolutely okay if you are concerned about the level of care that you got. And I just want you to know we're not all like this. I promise there's so many good ones out there. I don't deny that there are some not so great ones out there, but please don't give up, and you deserve better care. And I know you will find it. Okay. This question was about somebody whose gynecologist had noticed they had a small labia and wanted to do a biopsy for something called lichen sclerosus, which is a disorder of the vulva that can cause some skin changes. And the only way we really know if you have it is if we do a little biopsy, and then a pathologist can look at a sample under a microscope slide and know for sure whether or not it's that. And this person said they looked up some videos. There aren't a whole lot on it. It sounds incredibly painful and terrified. A video on that would be helpful. And I could not agree more. I think that'd be a little hard for me to do a video on that, but I can tell you when we do biopsies, we numb up the area first. And so we use a very tiny needle because the area we're biopsying is so tiny. So it's not like we need to go far in. It's right under the skin. We use a very tiny needle. Honestly, it feels like a little mosquito bite usually, or very quick sting. And then we put some lidocaine to numb it. It's on the skin. So skin numbs up great with lidocaine. And then we use something called a little punch biopsy, which is a tiny circular biopsy where we just take a little top part of the skin and then put that in a jar and send that off. And then we can usually apply pressure or some medicine if there's any bleeding. So it's actually really not usually that bad. And I mean, we always numb that up. So if somebody is not offering you numbing medicine, you need to go somewhere else. But I will see if I can put together a video on that. Okay, question about what the heck's going on with those metal speculums. So somebody said, it would be more comfortable if the metal thingy was warm slightly and not cold. And I hear you. So some offices in the little, the table that you sit on, in the drawers, when you open them up, in those drawers, they're actually warmed. So the speculums are already warmed. And you might not even notice it because it might just feel temperature neutral to you. So you can always ask ahead of time if they have metal speculums, if they're in the drawer warmers. If not, you can just ask your provider to warm it under some warm water under the faucet before they use it. So yes, totally an option. Okay, last question that I thought we should address and I should follow up on is this lovely guy who was accompanying his then girlfriend to her OBGYN visit. They're now married, which I just think is so sweet. And I love it when partners come. And he said they used water as lube. It made little sense, but when I tried questioning it, they insisted water was the best practice. So yeah, that one bothers me so much. And I mentioned this in my last pelvic exam video that we should always be using lube. I feel it's an old school way of thinking, especially when we had older pap smears that were a little bit different. And the idea was that if you got any lube onto the cervix, and then when you did the pap smear, it could make the pap not as accurate or not give a result. I just think that that's ridiculous because if you're using the speculum in the right way, you can put the lube on it where it's never going to actually touch the cervix, and it helps with comfort. So I am pro lube, my friends. And if they say that they're not going to use lube, you can tell them that you're not going to do it unless they do. Now, there is one specific test that we do. It can be done in the office, but also on labor and delivery when you're pregnant, and we're trying to see if your bag of water is broken. And it's true that using lube there will interfere with one of our tests, but I'm talking about specifically like when you're coming in for your GYN exam, pelvic exam, we can absolutely use lube. So that really annoys me that that's still a thing out there. Okay, so those were some awesome questions I wanted to follow up on. If you have any other questions, go ahead and drop your comments in the comment section below and I'll answer some more. And I've got references and resources, links to other videos that you might want to watch just about this. And if you're not already following me on TikTok and Instagram at Dr. Jennifer Lincoln, go ahead and follow me. And let's keep talking about pelvic exams so that we break down the shame and you realize that these exams are not embarrassing and are so important to your health. All right, everybody, stay safe out there.